Aha, here's our patient. The patient has received all known antibiotic treatments to no effect. In conclusion, either he is not ill, or we have a new strain of microbes.
Or this could even just be a case of resistance to antibiotics.
There is an alarming development in the field of medicine that has researchers and practitioners very concerned.
It's not new, but the problem is intensifying. And if something is not done now, then very soon there may not be sufficient treatment for simple illnesses. What is it? Antibiotic resistance.
When organisms can no longer respond to antibiotics that have been designed to treat them, you then say that the organisms have become resistant. And this is what we call antibiotic resistance. Failure of microbes, bacteria, to respond to antibiotics specially designed to treat them.
Antibiotics were first discovered in the late 1920s by Alexander Fleming with the development of penicillin. Antibiotics are designed to treat bacteria. As far back as 2002, disease experts at the Pan American Health Organization PAHO called antibiotic resistance one of the most serious problems facing medicine. Consultant microbiologist at the University Hospital of the West Indies and a lecturer at the Faculty of Medicine at the University of the West Indies, Dr. Alison Nicholson, admits that antibiotic resistance is a natural occurrence.
It is a natural occurrence. It is something that you really can't prevent. It is something that is going to happen. So our role, or the challenge we face, is to try to slow its emergence for as long as we can in order to prolong the usefulness of the antibiotics that we now have.
So, if it is natural, why the alarm now? Dr. Kelvin Ehika Metalor is a critical care specialist at the intensive care unit at the University Hospital. Critically ill patients who go to the ICU use very high-power antibiotics.
Over the years, just like in most places all over the world, we are seeing increasing number of highly resistant organisms. Usually patients come to ICU. By the time they come to ICU, they've actually been through different kinds of antibiotics.
This is a major problem. The organisms are increasing in resistance, but the pharmaceutical companies have decreased the production of new antibiotics. So we actually are in danger now of having organisms that are resistant to all the antibiotics that are in existence, and that would be the major health crisis.
What is it that is contributing to the increase in resistance? Patients and doctors must take responsibility. Director of Pharmacy at the University Hospital, Dr. Arlene Thorborn, explains.
There is always the problem of overusage in terms of persons coming in. Once a patient goes to the doctor, even for the flu, they feel if they don't get an antibiotic prescribed, then, they may not get better, and so sometimes they get antibiotics prescribed.
There are persons who would probably take half the course of an antibiotic course. You're given a prescription, you get the antibiotics. You take 2 days worth and you feel better and you stop. We want that practice to stop. If you're given a course, then you need to complete the course. Failure to do so would actually be to expose the microbe, the bacteria, to the antibiotic, to learn its secret, and then for resistance to emerge.
Some patients can even obtain antibiotics without a prescription.
It's possible, but it's not supposed to be. In our setting at the hospital, persons come with a prescription. Nothing is dispensed without a prescription.
But as far as you know,
however, they can go elsewhere and ask for antibiotics without a prescription.
We are seeing resistance coming in from the community. These were things that we didn't see a few years ago. So we're seeing patients coming into the hospital for the very first time who should be sensitive to most antibiotics, and they are resistant right across the board.
Some marketing companies send antibiotics directly to general practitioners. That too can be dangerous and encourage the overuse and misuse of antibiotics.
Antibiotics like levofloxacin, ciprofloxacin, these are antibiotics that are marketed directly to general practitioners, and they use these antibiotics for things that maybe antibiotics that are less potent can work for.
But in the midst of this increasing concern about antibiotic resistance, advocates of the naturopathic way of life, like Ted Emanuel, is weighing in on the discussion.
Synthetic antibiotics, the body doesn't relate to well at all, as a matter of fact. Well, one can say, well, the purpose here is not for the body to relate to, but is to destroy the virus or the germs or the bacteria. So one would say, well, hey, either or. Either you take the antibiotics from the doctor and hopefully get rid of the virus or the drug, the bacteria, you know, or whatever they're using it for, or you seek other means. You have natural biotics. Almost 80–90% of the plants on the planet have some form of antibiotics.
And what does a world with limited antibiotic options look like?
That would be describing a situation where what to us would be relatively simple infections now are incurable. So before the advent of antibiotics, you know, simple skin wound infections could cause death. No, I'm not saying they never cause death, but I'm saying we can treat them far more easily. But no, if you have infections that would have been relatively easy to treat with antibiotics, except that the organisms causing these infections have become resistant to the antibiotics, then we're back at the stage where we were before antibiotics were introduced.
It can be frightening. One of the biggest problems in intensive care is infection. Intensive care anywhere in the world have the highest infection rate because you see the sickest set of patients. And so if you have a patient who is very, very sick, who needs antibiotics, and the antibiotics are no longer working for the patient, it leaves you with no option in terms of managing this patient.
Practitioners believe that more education about antibiotic resistance is needed among health professionals and the public.
We're actually lagging behind because in many other parts of the world, they've actually launched major campaigns to heighten public awareness so that people know what's happening.
As pharmacists, patient education and counseling is very important. So for example, you're trying to impress on the patient that you need to complete the course of medication. So if it's a 1-week course or a 10-day course, it must be completed in order to be effective. General instructions, how to take the antibiotic. So for example, if you say, take it on an empty stomach, it sounds like a very simple instruction, but it may be that it affects the absorption of the drug. So they won't get enough drug in the body to be effective.
Pharmaceutical companies are reducing their production and the options are narrowing.
Our medical doctors ought to learn about natural immune enhancers. Very important. How are you going to prepare that person who is infected so that the cells can absorb? The Ministry of Health ought to get more involved in naturalism.
Bacteria are smart and are fighting back. What will the health sector do to stand up to their resistance to the ever-decreasing slate of antibiotic options?